Thank you, and welcome to the Live with Renk show, Senator Bizon. And I'm hoping you toughen up, Senator Bizon. All right?
All right. Thank you so much. I'm going to try hard to toughen up just for you, Renk.
All right, thanks. Me too. No, I need to toughen up too because I'm one of those guys that thinks she's gone overboard. Well, as you know, we had Senator Hertel on earlier, and it's really what I want, and I want to focus us on is moving forward and how we get to the point where we're moving forward. The House put out their plan. Let me ask you this. Who put together this plan? Because he's saying, he being Senator Hertel, that only Senator Shirkey, the Senate Majority Leader, put this out, when there is a bipartisan group of senators, I think he said 3 Republicans, 3 Democrats who are working on something. So he doesn't know why the Senate Majority Leader put this out. Although he did compliment that he put a bipartisan group together. He doesn't know why he did that. Where are we with that? Why? Whose plan was it? Is it? Why was it put out last Friday?
I believe that we were looking at exactly how effective that bipartisan commission is being able to move forward. And it seems like there are significant divides between the two caucuses, between the Republican and Democratic caucus, as to the speed at which we need to move and exactly what's going to be involved in moving us forward as a state. And I think that it was largely because of that the Majority Leader came out with one plan that he and much of the caucus is supporting. And that will probably be different than the Democrats' response to the plans.
So what is, I explained the plan yesterday, and that is a phase approach, very much like the House that has a tier approach, 3 as opposed to 5. Let me ask you the bigger question, because we went into the details of the plan yesterday. How serious is the Republican caucus in the Senate to get us out of this shutdown and working? Are they seriously looking at the first week of May? Because Senate Majority Leader Shirkey came out yesterday, or maybe over the weekend, and said that he does not see an extension of this declaration, at least to the extent that it is moving past the end of April.
I think that's the very first thing that we need to do as a Senate caucus is to get together with our brothers in the House and come up, and I use that term generically, our brothers and sisters in the House, of course, and come up with a plan that both the House and the Senate can get behind, because at that point in time, then we will have something that I think is much more representative of what the people of the state want us to do and be able to move forward with.
Well, here's a question. Oh, I'm sorry. I thought you were done.
Go ahead, please.
Here's a question I have, and I didn't hear it from Senator Hertel, an answer, and that is, what's the process? Is it because of the emergency declaration? The governor doesn't care about anybody else's plan. It's her plan or no plan. Or does there have to be a buy-in, signing, or agreement between all 3 branches of Michigan government?
In the past, we've tried to be supportive in the face of the public health implications of the virus spreading throughout our communities. And at this point in time, I think that a lot of that impetus is by the wayside, and now we need to focus on things that are important to our citizens, and getting back to work and saving the businesses seem to be one of the things that is definitely on their mind, as you can see by the protests that you're having not only here in Michigan, but across the entirety of the United States. And so the process in the past has been one of bipartisanship to some degree. No one expected her to ratchet down the way that she did following the latest extension. But the consensus of opinion is that now we need to take a look at alternatives and to, as I was saying before, get together with the other house and proceed with what we can conjointly come up with.
So does she need buy-in from all you guys, or can she just decide this is how we're going to open?
Well, it depends on which part of the Constitution and which part of law that she is following.
Okay.
If she is following the 1967 dictates. It says that she can have an emergency declaration that lasts for 28 days, but then it needs to be enabled by the legislators if it's going to go forward.
All right, I've got to go to break. You're listening to Live with Renk. I took it to the last second. We'll be right back after this. Some of you might have thought, what is he restarting his show there? That's where I got that song from, or that piece from, in the beginning of my opening bed of my show. Good morning and welcome to the Live with Renk show. On air with me is State Senator Dr. Bizon, who is discussing the Republican response to what is going on out there in regards to reopening or starting to prime the pump on our economy. So thanks for holding on, Dr. Bizon. Prior to the break, you were talking in regards to, I'm trying to figure out, and I don't know if anybody knows because there's so many different conflicting things out there. Does the governor have the right to say it's my plan or no plan, or does she have to have buy-in? Do all three of I should say the House, the Senate, and the governor's office all have to sign off on a plan, or can she just institute a plan? Does that matter when it comes to the emergency declaration? If you wait till the day after, let's say on May 1st, when that declaration ends at the end of April, then the Senate can put something together in the House, or even worse, can she wait for the end of the declaration, let's say April 30th, and then on May 2nd, ask for implement another 28 days? Go ahead, Senator Bizon.
The Constitution and the laws are very specific in limiting her to 28 days under the 1967 rules. The rules prior to that were apparently overlooked when that law was placed into effect. And there is a 1945 statute, something from before. We were just getting out of war before the Constitution was rewritten, that says that she has certain emergency powers that are somewhat more limited in scope. The 67 revision specifically states in the reasons for her declaration an epidemic, and so it may be limited to 28 days. And if it is, then she would need legislative buy-in in order to effectively put out additional emergency orders.
But if she waits 2 days or a day or two between the two, can she just re-up for another 28 days according to the law? I don't know if you know that or not.
I am just guessing here because I'm not a lawyer.
Right.
That there would probably be a question brought before the Supreme Court, probably in the line of a case, and that may take a little bit to resolve because they don't move very quickly.
Right. All right. So is there anything else you would like to address or expound upon?
I was very excited to listen to your program today. Thank you so much.
Well,
I didn't get all of it because I was on a number of different phone calls already today, but we always enjoy hearing you.
Well, thanks a lot.
I found that it was very, very interesting that we had information coming out of California where they're doing this antibody testing somewhat more widely to see if you have the antibody, and it's showing dramatic results in that city where previously they thought that they may have 8,000 cases, and now it's showing something in the order of 220,000 people to 440,000 people having antibodies against the virus.
Was that the
And
Stanford?
so
I think Stanford, were they the ones doing that one that I'm talking about where it's 50 to 85 times more spread out there than anybody thought? And it's due to the fact that so many people had it, but their symptoms were so minor they didn't even go to a doctor or anything?
yes, I think it may have been the Stanford
Okay.
study that we're both talking about. But that would change the instance of mortality from this disease to something like 0.1% to 0.05%, depending on which of the limits that we're using. And that isn't terribly different than what we're seeing from the common flu. I think that it's important that we make sure that those who are at risk are taken care of, and I dare say that send them off to the store is probably not the very best way of taking care of them. They ought to be quarantined with one open window that you can pass food and whatever else they need into those premises. And the same thing with those who are infected. If we know that someone's infected, we ought to go way out of our way to protect them. The wild card in this, of course, is those that are walking around that are that you don't know are infected, that are feeling well but still spreading the disease. And recently I was dismayed when I found out that when we take a look at the quarantine that we currently have, perhaps because it's so confusing, and perhaps because there are so many exceptions that allow people to go out, that it's probably only about half as effective as it ought to be. It seems like the initial studies I got from the legislative briefing from the administrative branch in a survey that they had done said that about half of the people are going and actually getting out into society. I would argue that masks can be very effective. We have the N95 masks that prevent transmission 95%. And if you are talking about two people passing in the wind, that the transmission rate, if they were both masks with N95 masks, the transmission rate between those two would be minimal. It would be 0.05 times 0.05 or 0.002 risk of transmission. Not everyone's mask is quite so effective, but you have people on credible sources, doctors, coming out saying that you can make your own HEPA mask at home out of a vacuum cleaner bag that is HEPA rated. And
so if I may, because we're running out of time here, I'm sorry to interrupt you, but I wanted to, before we run out of time, so there's a lot of cars out there. I agree. And when I'm driving back and forth from work, I see a lot of people out there. Sometimes it's similar to what we had prior to this. And I think that's because you can only keep people, whatever, jailed up or whatever. Quarantined for as long as you want. But am I hearing from you that you thought this should have been stricter? Because that's the impression I got, that maybe there should have been more stricter rules and not as many exceptions. And sorry, but I only have 40 seconds.
Okay. I would say yes. You need not only, but not for the entire population, you need to protect and make sure that the population can move around safely and protect those at risk and isolate those who have infection. And I'm not sure that we have emphasized the importance of wearing efficient masks when we go out. And that may have been even more beneficial than shutting down the entirety of the economy.
Oh, I got you. All right. Thanks a lot for coming on, Senator Bizon. Appreciate that very much.
Thank you.
You have a great day.